Blackheads are a common skin condition caused by clogged pores. They occur when oil and dead skin cells build up and become trapped in the pores, creating a dark plug.
Mihira, is there anything I can do to prevent blackheads?
Yes, there are several steps you can take. First, gentle cleansing is essential to remove excess oil and dirt. Avoid harsh scrubs that can irritate the skin. Second, consider using a non-comedogenic moisturizer to keep your skin hydrated without clogging pores. Third, limit your use of makeup, especially oil-based products.
I've tried using over-the-counter acne products, but they haven't helped much.
Some over-the-counter products can be effective, but it's important to choose the right ones. Look for products containing salicylic acid or benzoyl peroxide. However, if your blackheads are severe or persistent, you may need to consult a dermatologist for further treatment.
Are there any procedures to remove blackheads, Mihira?
Yes, there are professional treatments such as cum-done extraction and chemical peels. These procedures can help clear blackheads and improve the overall appearance of your skin.
Mihira, I understand your concern about your hair loss. It can be quite distressing when you notice persistent changes like this. It's important to remember that some hair shedding is normal, but when it continues or seems excessive, we need to look into it further. If you find that your hair fall persists or even seems to be getting worse over the next few weeks, the most important next step is to consult a doctor or a dermatologist. They can conduct a thorough examination and may recommend specific treatments. These often include things like topical applications, which are special medicines applied directly to the scalp to stimulate growth or reduce shedding. More importantly, they will also check for any underlying medical conditions. Sometimes hair loss can be a symptom of something else going on in the body, such as a vitamin deficiency, hormonal imbalance, or a thyroid issue, and treating that root cause is key to resolving the hair loss. To ensure we are monitoring this effectively, I would strongly suggest we schedule a follow-up appointment. This is necessary if your hair fall continues without improvement, or if you develop any new symptoms like redness, itching, or changes to your scalp. This check-in allows us to track your progress and make sure you receive the most appropriate and effective care.